Hi, I'm Dr. Jeff Anderson. I'm a doctor of chiropractic and acupuncture in the Southwest Denver area. For over 22 years, I've helped people get rid of pain as quickly as possible without the use of drugs or surgery. In last week's video blog, we talked about whether or not taking an ibuprofen or an NSAID drug was a good idea for your back pain. In today's video, I want to share with you some effective alternatives on what you can use besides ibuprofen or an NSAID drug for that pain. Non-steroidal anti-inflammatory drugs such as ibuprofen are commonly prescribed for arthritis and other chronic painful conditions. Yet these are some of the most dangerous drugs that we can use in the world. Every year, 100,000 people are hospitalized as a result of taking ibuprofen or an NSAID drug, and 15,000 of those people every year die as a result of taking an NSAID drug or ibuprofen. NSAID drugs also have potentially devastating side effects, especially for the elderly. Potentially devastating side effects from taking NSAID drugs can include a 60% increased risk for cardiovascular heart disease, up to a 65% increased risk for heart attacks, a 10 to 30% increased risk for allergic reactions, and up to an 80% increased risk for miscarriage. There were over 7,000 people that were hospitalized due to GI complications as a result of taking an NSAID drug last year. Common names for NSAID drugs include Voltaren, Celebrex, naproxen, ibuprofen, and aspirin. However, since 2004, NSAID drugs have slowly been taken off the market. In 2004, they did take Vioxx off the market for safety concerns, and in 2005, they gave Celebrex a black warning label box. So how do we eliminate NSAIDs from our life and still want to manage our pain? Here are a few nutritional alternatives for you. Number one of the first things that we can do is to remove pro-inflammatory foods from our diet. Two of our biggest culprits are sugar and flour. These two non-nutrients raise insulin and help promote pro-inflammatory prostaglandins in the body. Two great foods that we can replace these non-nutrients with are fruits and vegetables. Typically, the higher the water and the lower the sugar content, the better. Number two, taking a high-quality animal-based omega-3 supplement such as fish oil or krill oil can be a very effective way at counteracting pain and inflammation, much like an NSAID or an ibuprofen drug. Did you know that ibuprofen and omega-3 chemistry works almost the same way? Omega-3s help counteract pain by helping balance out omega-6 fatty acids in the body, which are pro-inflammatory. An ideal ratio for a healthy person is 1:1 omega-6 to omega-3. Even a healthy person will have a 4:1 omega-6 to omega-3 fatty acid ratio. People start feeling chronic degenerative pain somewhere when the ratio becomes about 10:1 omega-6 to omega-3. The average American is at 15 to 25:1 omega-6 to omega-3 fatty acids. Just to give you an idea, a bag of Lay's potato chips will put you at a 40:1 omega-6 to omega-3 fatty acid ratio. Number three, one of my favorite alternatives to NSAIDs or ibuprofen is using ginger or turmeric. These are two compounds that work as great natural anti-inflammatory agents. Not only do they work really well as an anti-inflammatory agent, but they can also be used as an antibacterial and an antifungal as well. A Journal of Complementary Medicine article in 2010 found that 2,000 milligrams of turmeric is equal to about 800 milligrams of ibuprofen. Now, is ginger turmeric safe for everyone? Anybody that can't take an NSAID drug because of blood thinning should not be taking ginger or turmeric. And anyone that's pregnant, it is advised not to take ginger or turmeric. But otherwise, ginger and turmeric are very safe alternatives for NSAID use. Number four. A great underutilized mineral that can be used for deflaming and help control pain in your body is magnesium. Magnesium plays a critical role in nerve tone, muscle relaxation, and increased absorption of nutrients. Sources of magnesium include foods such as spinach, tofu, oat bran, barley, fish oil, olive oil, white beans, sunflower, and pumpkin seeds. Magnesium can also be taken orally in supplement form or topically in the form of an Epsom salt bath. Clinically, what I recommend for my patients is magnesium glycinate. Usually I recommend 400 milligrams per night per patient, or I recommend a hot Epsom salt bath. Other great anti-inflammatory nutrients that can be used in conjunction with our other strategies include boswellia, bromelain, and cayenne pepper. So in conclusion, the 4 possible strategies that we have to replace ibuprofen or NSAID drugs include eliminating pro-inflammatory foods from the diet such as sugar and flour, taking 2,000 to 3,000 milligrams of a high-quality animal-based omega-3 supplement such as fish oil or krill oil. The higher the EPA-DHA count, the better. Using alternative herbs such as ginger, turmeric, cayenne pepper, boswellia, or bromelain. And getting some magnesium into your body in the form of food, supplement, or an Epsom salt bath. Tune in next week where I will share some movement strategies to help you quash your pain and keep you pain-free.